hard to address that beyond that. You would still be able to be escorted to the plane. You would have to, show them this card that you might set off the metal detector. But other than that, I don't know of any specific problems with flying. Yes, sir.
Insurance companies cover these?
So this is FDA approved. Medicare and insurance pays for this. So unfortunately, I'm going to skip over this story again because our microphone situation isn't optimal. But so when again should you be evaluated for this? So well, we would love to take care of you from the get-go. So we think we have a very good team that can handle your Parkinson's disease even if you don't need DBS. So the take-home message from this should not be, if I don't need surgery, get out of here or whatever. We really think that we can offer you a very comprehensive, complete therapy. And I think, if that's the case, then you would be comfortable with us should there be a time where you do need surgery. But so when is the time to think about surgery? Especially if you're happy with your neurologist or whatever else, when is the time to ask him about it? So when you're having difficulty controlling movements, despite having tried several drug combinations, or when you're having side effects from the drugs. So we really operate on people almost as often for side effects from the drugs as we do because of actual Parkinson's disease. So again, when are we talking about having surgery? So people that should not be thinking about surgery yet are people that have tried only a couple medications, people that are only taking a little bit of Sinemet, people that don't have complications due to medications. So we don't want to operate on people like that. You might not need surgery. You should be exploring your medication more. You should be increasing your dose of Sinemet. So when do we want to think of surgery? When there's a significant polypharmacy, when you're taking a lot of medications, when you're taking a lot of Sinemet, either many times a day or you're taking large doses. You might be taking a gram of Sinemet. You might be taking 2 pills 6 times a day or something like that. You might be taking less. None of these are absolute rules. This is the general picture. When you're having complications from your medication, no matter what you do, you can't find that right zone. You either feel like you're taking too much or too little, but you're not. You're taking the right amount, and it's not working, and you don't understand why. That's when we want to see you. That's when you would benefit from surgery. Just 1 second. Let me finish this last column, and then we'll get to you. So, and when do we not want to operate on you? Well, you could be taking any kind of medications, but the most important things are, if that drug didn't help you, if the Sinemet did not help you at any point, you're not going to get better with surgery. That's the first thing. So if levodopa, if Sinemet, it didn't help you, you're not going to get better with surgery. In fact, you might not have Parkinson's disease, but you may have a Parkinson's-like disease. But that's something to address with your neurologist. And we can't operate on you if you're demented, if you're pretty sick and you're pretty, at a certain point, we think you're kind of too far gone. That despite surgery would still work, but it's just not going to help you as a person. And that's the goal of this. And those people we don't offer surgery to either. But that's not to say there aren't other things we can do for you. Sir, in the red sweater.
Is there any indications that physical training or trying to keep in shape would help
physical therapy?
Well, I think I'm hearing a couple different types of questions here. So I'll take the easiest question first, which is physical therapy helpful? It's absolutely helpful. I mean, so in people that have or have to learn how to walk in a different way, or how to learn how to accommodate with losses in function they used to have, physical therapy can be helpful. Some of physical therapy is just exercise. Strengthening muscles will help your disease. Now, the other question I heard is, will physical therapy impair the progression of the disease? Well, I don't think we know of anything right now that slows down the progression of the disease, but if you need to see this in a big picture, which is if you're doing better, you're doing better. So we know the disease is going to continue. And right now, there is nothing out there that I or anyone else can offer you to stop that. But if we can come up with things that can help you function till later in the disease, well, I think that's pretty good. And that's what we need to be thinking about today. Yes?
A person who does physical activity, exercise on a regular basis, and keeps in good shape, in normal life, will do better than the other kind of people just walking
No
around.
matter what the
Right.
disease.
So in the case of Parkinson's, a person who's keeping in good physical shape and keeping active will manage to be able to be more physically active and have more control even as the disease progresses than a person who wouldn't.
Without a doubt. So just one slide on treatments being studied. So stem cell transplantation, growth factors, gene therapy. These are all very exciting prospects in the future. But none of them are really here yet. In fact, none of them are even close to here yet. Certainly, some of these are being studied more actively than others are. And I'm in no way saying there aren't papers you can find on the internet or somewhere else of some great result in 4 people here or 2 people there. But I don't think that any of those things have any proven efficacy yet. And while I would always keep my fingers crossed, I wouldn't be holding out too much hope for that in the next decade. So the future. So we do hope that in the future there will be better treatments for Parkinson's disease. So deep brain stimulation is safe, it's effective, and it's adjustable, and it would not likely prevent you from trying a new treatment in the future if it was developed. So again, the goals of all of this, no matter what path you choose, are to regain your lost independence. So if you're troubled by the symptoms of your disease, I think there still is hope. Our team of neurologists, neurosurgeons, our therapists will work with you to treat all of your symptoms, and surgery is one, but certainly not the only option to help you. Thank you. So I'll take some questions. I'll just start, and work my way back with no prejudice towards those in the back.
What's the estimated cost if you didn't have insurance
So
of the entire?
The estimated, if you had no Medicare and no insurance, I don't even know. We would certainly work with you to help you beforehand. I couldn't estimate it. No one's ever had to pay for it, out of pocket. I couldn't answer that.
With someone who has one of these
So that's a good question. So we know the answer to that from when batteries stop working. When batteries stop working, it's like you never had it on. For Parkinson's disease, different diseases that we do this for, that answer is not quite so straightforward. But if you have surgery for Parkinson's disease, when your battery stops, it's like you never had surgery. You need that battery.
or it can be removed at any point why it should be removed.
So the only reasons we typically remove these are for infection.
On the bottom of that sign, all 4 of those locations where you practice from, or is that something totally?
Yes and no. I do. I see patients more routinely in the Nassau offices, but I will see people wherever's necessary. I don't even know the address in West Islip.
Well, that's scary.
Well, I just put it in the car and it tells me where to go. Yes. Is Parkinson's hereditary? There are very small subsets of patients with Parkinson's disease have a hereditary type of disease. For most people with Parkinson's disease, there is no hereditary component. If you were very young or that your loved one was very young when they developed the disease, I think some centers would suggest genetic testing. Certainly the majority of patients that develop Parkinson's disease develop it for reasons we do not know about and do not have anything they will pass on to anyone in their family.
Someone develops Parkinson's, they're not lucky enough to just have Parkinson's, they have many other conditions. When you do this type of surgery, is there anything that would, such as immunosuppressants from a previous transplant of some kind, would that affect the surgery?
So very little affects the surgery if a medical doctor says you're safe. You couldn't be actively on anticoagulation, Coumadin, aspirin, Plavix, but those things could be resumed a short while after surgery.